Have you wondered what hidden dangers could be silently destroying your kidneys? According to the National Kidney Foundation, 1 in 3 American adults is at risk of kidney disease, yet many are unaware of the hidden threats lurking in their daily lives. In this video, we'll uncover 5 surprising hazards that may be harming your kidneys without you even knowing. By understanding these risks, you'll be empowered to make simple changes that can protect your kidney health and improve your overall well-being. Stick around until the end of this video to gain invaluable insights on how to safeguard your kidneys and enhance your health. In December 2022, a 55-year-old woman with kidney disease arrived at the emergency department. She was lethargic, had a dangerously low heart rate, visible swelling, and a body temperature of just 93 degrees. The doctors immediately tested her creatinine levels, suspecting a worsening of her kidney disease. What they discovered was shocking. Her serum creatinine level had skyrocketed to 3,530 milligrams per deciliter, several times higher than it had been just 2 months earlier. Her kidneys were failing, and she had stopped producing urine. Overwhelmed by uremic toxins, she was swiftly transferred to the intensive care unit and started on dialysis the same day. The doctors were puzzled. What could have caused her kidneys to deteriorate so rapidly? After thorough investigations, they identified the culprit, a seemingly harmless vitamin that thousands of people take every day. As someone who has worked with kidney disease patients for over 10 years, I must warn you about the hidden dangers lurking in your bathroom cabinet. No, it's not a prescription drug, it's a vitamin supplement. There are 5 vitamins that can be extremely dangerous if taken incorrectly. Today, I'll show you the serious dangers these vitamins pose to people with kidney disease. While not taking vitamin supplements can be bad for your kidneys, you must also be careful with what you take. The case I just mentioned is one of many hospitalizations due to incorrect vitamin supplementation, and we'll see how it ended for her later in this video. But she's not an isolated case. Just a few months ago, a TikTok influencer ended up with kidney stones because of a vitamin she was taking for her immunity. Earlier this year, a 61-year-old man was hospitalized with excruciating pain due to what doctors believed was pancreatitis. They were shocked to find out that the cause of his pain was a vitamin supplement. Another patient was hospitalized with recurrent vomiting, nausea, leg cramps, and a weight loss of 28 pounds, all from taking a vitamin in excess for just 1 month. His kidneys were destroyed. I'm sharing these cases because it's imperative to be informed about the supplements you take, their doses, and their risks. For people with kidney disease, improper vitamin supplementation can be especially dangerous. Those with impaired kidney function cannot properly dispose of excess vitamins, putting their kidneys at risk. If you follow me regularly, you know to be cautious with supplements, especially vitamins. Today, we'll discuss 5 hidden dangers not many people are aware of. Some of these vitamins are dangerous only if taken in the wrong form or dose, while others are always risky for those with kidney disease. So, let's be very careful with these 5 vitamins. We'll start with the least dangerous, number 5, and then move on to those that are increasingly harmful. Number 5. The right way to take vitamin D. What you need to know: we need vitamin D for healthy kidneys. Has something changed? Well, let's clear that up. Yes, it's true that vitamin D is essential, but there's a catch. Vitamin D is fat-soluble, meaning it can build up in your body if you take too much. It's also used by the body to absorb calcium and phosphorus. Too much vitamin D can lead to hyperphosphatemia and hypercalcemia, both of which can cause serious issues like arterial calcification. In fact, excessive vitamin D can directly cause acute kidney injury or fast kidney damage. This is why cautious about those recommending high doses of vitamin D. It's much more common for people to have low levels of this vitamin than too high, which can also harm the kidneys. So, how do we avoid these pitfalls? Take vitamin D in the right dose, typically around 2000 IU per day. Always pair it with 100 milligrams of vitamin K2 to prevent arterial calcification and take it with magnesium. This ensures you're taking vitamin D safely. If you find this information helpful, please share this video with anyone who has CKD, and give it a like so more people can see it. I know it can be scary to think that some vitamins can be dangerous, but it's always better to be informed and protect your kidneys. There's another vitamin you need to be cautious with, especially the synthetic form, but more on that later. Number 4. Poison number 4, cyanocobalamin. Let's talk about cyanocobalamin. It's the synthetic form of vitamin B12, and unlike the natural form, methylcobalamin, you won't find it in food, only in supplements. This can be a problem. You see, when most brands make multivitamins, they often use cyanocobalamin instead of methylcobalamin because it's cheaper to produce. But here's the catch: cyanocobalamin isn't found in nature, and if you have CKD, it could put you at risk of cyanide toxicity. Yes, you heard that right. Cyanocobalamin contains small amounts of cyanide. While most people can process it without issues, those with reduced kidney function, low GFR, might not be so lucky. A study points out that metabolism of high doses of cyanocobalamin can generate small amounts of cyanide, which might not be cleared efficiently in people with CKD, potentially causing faster kidney damage. So, what should you do? Be very careful with your vitamin B12. If you need to take it to avoid anemia, make sure it's methylcobalamin, not cyanocobalamin. Check your supplement bottle and ensure you're taking the right form. For CKD patients, 6 micrograms a day of methylcobalamin is usually recommended, especially if you're on a plant-based diet. Remember, vitamin B12 isn't well absorbed by the body, so manufacturers often pack huge amounts into supplements to overcome this, sometimes even 100 times the recommended daily intake. Always double-check your labels. But also remember, vitamin B12 is essential for your health, and if you're following a renal diet, you can only get it from supplements. Don't risk a deficiency, as it can lead to several dangerous symptoms, including elevated homocysteine and vascular disease. Number 3. Hey friends, this next one is even more dangerous. This everyday vitamin might be making you sick. Studies have linked it to significantly increased blood pressure, and it might even raise the risk of stroke and cancer. Other research shows it can lead to bone loss, raised cholesterol levels, and even kidney damage in the general population. Despite these dangers, this vitamin is still being manufactured. Be cautious and avoid alpha-tocopherol, the synthetic form of vitamin E. If you follow me regularly, you probably know that vitamin E is not something you should supplement if you have kidney disease. The issue with alpha-tocopherol is that it's everywhere: supplements, nutrient-dense powders, drinks, and food. Check the labels on anything you take regularly, especially if you have kidney disease. Now, natural vitamin E can be beneficial because it's a powerful antioxidant, and high-potency antioxidants are promising for kidney disease treatment. However, I still don't recommend supplementing vitamin E unless your doctor explicitly prescribes it, especially not the synthetic form. If you need vitamin E, get it from foods. Sunflower seeds, for example, are a real powerhouse. Just 1 ounce contains up to 66% of your daily value for vitamin E. That's a lot. In short, don't supplement vitamin E, particularly the synthetic alpha-tocopherol. It's dangerous, especially at high doses. Always be careful with any supplement containing this vitamin. Number 2. Now, let's talk about the one vitamin even more dangerous than alpha-tocopherol, vitamin A. This vitamin can damage your kidneys even if you get it only from foods. Yes, that's right, there's only one vitamin that can do that, and it's vitamin A. Vitamin A is the main reason why multivitamins are banned for people with CKD. If your kidneys are impaired, you cannot take a regular multivitamin like Centrum, SmartyPants, or Superdin if you're in Europe. None of these are safe if you have reduced GFR, and the culprit is vitamin A. Even the amount of vitamin A you find in multivitamins or certain foods can cause kidney damage. This vitamin can accumulate in the body and become toxic, leading to potential adverse effects such as birth defects, liver toxicity, and other health issues, including rapid kidney damage. People have been hospitalized with acute kidney injury just because they ate too much fish liver. While it's not very common, it's still a risk. The dose of vitamin A present in normal supplements is not safe for people with kidney issues. Stay vigilant and always be careful with vitamin A, especially if you have kidney disease. Number 1. Okay guys, it's time for our number 1. I bet you're curious about which vitamin destroyed the kidneys of the 55-year-old woman I mentioned earlier. This vitamin is known for causing immense damage in just 2 months. While it might not be as notorious as alpha-tocopherol or vitamin A, it's linked to far more hospitalizations than both combined. So, which vitamin was she taking? According to her doctors, she was on a long list of supplements: calcium, digestive enzymes, cranberry, a daily multivitamin, vitamin D, and vitamin C, but only one of these caused her hospitalization. They identified it by examining her kidneys, which revealed a massive amount of oxalate crystals. The culprit? Vitamin C. The woman was taking 1,000 milligrams of ascorbic acid daily, and this dose was enough to permanently destroy her kidneys. Unlike typical cases with kidney stones and oxalate crystals, she couldn't regain her kidney function. This is why vitamin C is our number 1 today. The worst part? A dose of 1,000 milligrams per day is not unusually high. Many brands sell vitamin C in this exact dose and even recommend it on their bottles. This dose can be incredibly harmful, especially for those with CKD. Yes, this is a sad story and a cautionary tale. Always make sure you're not taking vitamins in too high doses. Just because a little bit is good doesn't mean a lot is better. If you take vitamin C supplements, check your dosage. While 100 milligrams a day is usually fine, 1,000 milligrams a day can destroy your kidneys. As I mentioned, supplementing vitamins in the right dose is crucial for most CKD patients. Understanding these hidden dangers is crucial to protecting our kidney health. If you or someone you know has experienced issues with kidney function, share your story with us in the comments below. Your experience could provide invaluable support to others facing similar challenges. This is a vitamin lowers creatinine level and stops proteinuria fast. Have you ever wondered if there's a simple way to stop proteinuria and lower your creatinine levels quickly? Imagine discovering a vitamin that could make a significant impact on your kidney health in just a matter of days. According to a recent study by the National Kidney Foundation, a staggering 37 million Americans are affected by chronic kidney disease, with proteinuria being a common and dangerous symptom. But what if I told you there's a breakthrough solution that's not only effective but also easy to incorporate into your daily routine? Supplementing with just 2 micrograms of this special vitamin D can lead to a 34% reduction in proteinuria levels. For some patients, this is all it takes to halt kidney disease. In this video, we're going to explore how to use vitamin D, along with 6 other tips, to effectively control proteinuria. This is an incredibly important topic for anyone dealing with kidney disease. Science clearly shows that your actual proteinuria levels can predict whether your kidney function will improve or worsen in your next blood test. By the end of this video, you'll be equipped with the knowledge you need to make informed decisions about your health and take proactive steps toward a healthier life. This knowledge can make a real difference for those suffering from kidney disease. So, if you're ready to take control of your kidney health and discover a game-changing solution, keep watching. Don't miss out on this valuable information that could transform your well-being. Let's dive in and uncover the secrets to better kidney health together. Ways to stop proteinuria now. Don't miss our number 1 tip, because without it, you won't get the results you want. But before that, let's talk about a crucial vitamin you absolutely need. Number 5. Vitamin D analogs. There's a reason why vitamin D is called the kidney vitamin. Your kidneys are responsible for activating this vitamin, making it usable by your body. However, up to 84.7% of kidney disease patients have low levels of this vitamin, which is a significant cause of proteinuria. This is why supplementing with this vitamin in its prescription form can result in a rapid improvement in proteinuria levels. How effective is it? In a recent placebo-controlled trial, kidney disease patients who took 2 micrograms of pericalcitol, a vitamin D analog, saw a massive 34% drop in proteinuria levels in a short amount of time. Pericalcitol is a vitamin D analog that your doctor needs to prescribe. It's not the same as the vitamin D you can buy at the store. Another review of studies confirmed that taking vitamin D analogs like pericalcitol significantly reduces proteinuria. So, have you been prescribed a vitamin D analog for your kidney health? Not all doctors remember to prescribe this life-saving vitamin to kidney disease patients. If you have kidney disease, especially in advanced stages, and if proteinuria is present, you need this vitamin D analog. Regular supplements probably won't activate enough vitamin D to be effective against proteinuria. So, talk to your doctor. Number 4. If your doctor hasn't already prescribed it, number 4 is omega-3 fatty acids. Like vitamin D, omega-3s are essential nutrients, meaning your body can't produce them on its own. Without enough omega-3s, your body will suffer, showing symptoms of deficiency. While you can get some omega-3s from foods like walnuts, chia seeds, and other nuts and seeds, it's important to take a good omega-3 supplement. Why? Because the conversion of alpha-linolenic acid, ALA, from plant-based foods into the forms your body can use, EPA and DHA, is not efficient. This inefficiency can put you at risk for a deficiency, which may cause kidney damage and proteinuria. Remember, any deficiency in essential nutrients causes symptoms, and these symptoms can sometimes put your kidneys in danger. So, start taking a good omega-3 supplement if you aren't already. But what does this have to do with proteinuria? Science shows that omega-3 fatty acid supplementation is associated with a significantly reduced risk of end-stage renal disease and delays the progression of kidney disease. A large review of studies with 444 kidney disease sufferers proved this. Researchers also found that supplementing with omega-3s was associated with a lower risk of proteinuria. I always recommend keeping supplement use to a minimum, but omega-3s should be on your short list. A dose of 1,000 milligrams a day of combined EPA and DHA is a good starting point, with higher doses reserved for treating specific conditions. Taking 1,000 milligrams of omega-3s per day is probably the easiest step to help manage a condition as complex as proteinuria. If you find this information useful, consider sharing this video with a friend and giving it a like. Up next is a step that will directly help your kidneys. But first, a question: how can you tell if your proteinuria is too high? Proteinuria often comes with noticeable symptoms, like a foam that forms on top of your urine. But you shouldn't rely on symptoms alone. Your proteinuria level can predict how your kidney function will evolve. This level is crucial for those with CKD and for those at risk, like those with diabetes or high blood pressure. Want to know how to tell if your kidneys are going to get better or worse? Let's see how you can read your proteinuria levels yourself. This level is usually indicated on your blood analysis as ACR, but you might also see it as albuminuria or proteinuria. Once you've identified your levels, refer to this table. If your albuminuria is below 30 mg per g, you're likely in the green zone, meaning your kidneys are stable and improvement is possible. If it's between 30 and 299 mg per g, you're at risk of your kidney disease worsening, putting you in the orange or red zone depending on the stage. Levels over 300 mg per g are concerning, placing you in the red zone. If this happens, you need to take all the steps I'm showing you in today's video. What you're learning today can make a real difference. Number 3. Our number 3 tip for today is to watch your protein intake. Yes, this is absolutely crucial. You might think, less protein means less proteinuria, right? Well, it's a bit more complex than that. It's true that limiting protein intake is supported by scientific literature as a way to slow down and even reverse the decline of GFR. Reducing protein intake also has a significant effect on proteinuria. You can improve kidney function without improving your proteinuria level. What's not so obvious is how this works. One might assume that eating less protein directly reduces the amount of protein in the urine. But the amount of protein in the urine actually depends on the amount of damage to the kidneys, not on the amount of protein we eat. However, a low-protein diet can help reduce the workload on the kidneys, slowing the progression of kidney disease and protecting them from further damage. This can lead to better proteinuria levels in your blood tests. The low-protein diet is a big topic and extremely important for kidney health. Number 2. But don't go away yet, there are 2 steps even more crucial than reducing protein intake. Number 2 is reducing phosphorus intake. In the battle against kidney disease, cutting down on phosphorus is where modern science is clearly headed. And yes, the fact that foods rich in protein are also major sources of phosphorus plays a big part in this. This is why CKD patients need to avoid meat, fish, dairy, and many processed foods. These foods are high in both protein and phosphorus. While protein can be both good and bad for you, phosphorus is something you want to avoid as much as possible. In high concentrations, it's like poison for the kidneys. A recent study even found that limiting phosphorus intake may be enough for some patients to stop proteinuria and reverse the decline of kidney function. So, always be very careful with phosphorus intake if your goal is better kidney function. Follow a low-protein diet, use phosphate binders like calcium carbonate, and take all necessary steps. Phosphorus and the renal diet are big topics. We still have one more step to discuss, the most important one. So, What could be even more crucial than reducing protein and phosphorus? Stay tuned to find out. Number 1. The most important step, number 1, is to address the root cause of the damage. Proteinuria is a measure of kidney damage. To see improvement, you must stop what's causing the damage. You could follow the perfect diet and take all the right vitamins and supplements, but if your diabetes, for example, isn't under control, the damage it does to your kidneys will always outweigh the benefits of these supplements. On the bright side, many patients who found ways to manage their blood pressure and blood sugar levels saw immediate improvements in kidney function and proteinuria levels. Thank you for watching. I hope you found this information on how this vitamin can stop proteinuria and lower creatinine levels helpful. Remember, your health journey is unique and sharing your experiences can help others in our community. Have you tried any vitamins or supplements that have made a positive impact on your kidney health? Please share your stories and tips in the comments below. Don't forget to like, share, and subscribe for more health tips and updates.